Hi, I'm Daniela and this is Jocelyn. Thanks for coming back to our channel.
Today we're going to discuss when to consider seeing a fertility specialist. As we've mentioned in some of our previous videos, there's a general rule that if you're under 35 and you've been trying for a year, or you're over 35 and been trying for 6 months and have not seen success, then it's a pretty good indication that you might want to see a fertility specialist.
But sometimes there's more to it.
And that's what this video is about.
There's no wrong time to seek out a specialist, but in some instances, it can be better to do sooner rather than later. Today, we will discuss some scenarios in which you should consider seeing a fertility specialist outside of those more commonly known parameters. Being informed about your reproductive health is the best way to make educated decisions when growing your family.
Although an OBGYN or your regular gynecologist can help on the path to conception, it's also important to consider a fertility specialist because they have dedicated their career to reproduction and fertility issues, so they're going to have knowledge on the most up-to-date research on treatments and new studies and findings in fertility and trying to conceive.
That's why we feel it's best to seek out a trusted specialist in your area. Now let's get into some instances where you might want to seek out a fertility specialist right away rather than waiting the year or 6 months.
Although there are many methods to trying to conceive at home for same-sex couples, there's no time restriction on when to get a fertility specialist involved because a lot of times medical assistance will be needed for reproduction.
In our scenario, we started our journey by seeking out a fertility specialist and just getting baseline tests done. I wanted to make sure everything looked in order before we started trying at home.
Another situation where you'd want to get a fertility specialist involved is if you've had 2 or more miscarriages.
Research shows that 1 in 4 women will experience a miscarriage during their reproductive years. But just because they are common doesn't mean they're insignificant.
Experiencing 2 or more miscarriages is known as recurrent pregnancy loss. There can be many causes to recurrent pregnancy loss, and a specialist can talk through them with you, including risk factors, and possibly run tests to see ways to reduce that risk in the future.
You can also consider seeing a fertility specialist right away if you have irregular periods or you're not ovulating.
An irregular period could mean that you're not ovulating or releasing a mature egg during your cycle, which is necessary to get pregnant naturally. This can also be an indicator of PCOS or polycystic ovarian syndrome.
PCOS is the most common cause of ovulatory problems. A fertility specialist can help you figure out why your cycles are irregular and also come up with a plan to get your body back on track.
If you have problems with your uterus, like fibroids, polyps, or scar tissue, you may also want to consider seeing a specialist right away.
These issues can lead to difficulty conceiving or also miscarriages. Consulting with a specialist early on is a great way to prepare and possibly eliminate those factors altogether.
If you've been diagnosed or think you have endometriosis, you may also want to consider seeing a specialist. Endometriosis is a disease characterized by painful periods, irregular bleeding, pain during sex, and infertility.
Endometriosis can contribute to infertility in many different ways. For example, in our case, it caused a lot of scar tissue and cysts to form inside, which blocked the egg and sperm from meeting and having healthy conception.
Endometriomas, which are cysts on the ovaries, can negatively impact and damage your ovarian tissue as well as your eggs. And endometriosis can even affect the lining of your uterus, and that will impact implantation.
Patients with endometriosis are at high risk for infertility and should always speak to a fertility specialist right away.
And finally, anyone who wants to learn more about their fertility and family building options can see a specialist at any time. For example, someone who wants to freeze their eggs, someone interested in surrogacy, same-sex relationships, or single parents by choice are all great scenarios where a fertility specialist
can come in handy. There's no wrong time to seek out a specialist, but in some instances, it can be better to do sooner rather than later.
To recap, you should consider seeing a fertility specialist if you're curious to know more about your family building options, have suffered 2 or more miscarriages, have irregular periods or do not ovulate, have problems with your uterus, or think you might have endometriosis.
We hope that you found this content useful, and if so, please give us a like.
Be sure to subscribe to get more Lesbi-Honest updates.
We'll see you soon.